Today we're going to talk about the collateral branches of the brachial plexus. So first of all, we're going to draw the brachial plexus. And as we mentioned before, that the brachial plexus originates from the ventral rami of the spinal nerves from C5, C6, C7, C8, and T1. And we mentioned that ventral rami means the branches of the spinal nerves that originate in the ventral region or on the ventral aspect of the human body. So anteriorly, not posteriorly. So we have ventral and we have dorsal. Ventral is anterior, dorsal is posterior. So it originates from the interior, like divisions of the spinal nerves. And we also mentioned that there is no C8 vertebra, but despite this fact, there is a C8 spinal nerve. And then we have the roots, which will have a pattern like this, where the C5 and the C6 anastomose together, C7 stays alone along the way, and the C8 and T1 will anastomose together. And this will give us trunks. We have superior, middle, inferior trunks. And then the trunks will form divisions when they intermingle with each other, like this. This is the pattern of the divisions. And we mentioned that this will be anterior and the one left in red will be posterior. And then these divisions will give us chords. We have a lateral chord, posterior chord, medial chord, and the lateral and the medial ones will anastomose with each other, forming the median nerve. And we'll have here a terminal branch from the medial cord, which is the ulnar nerve. Another branch from the lateral cord, which will be the musculocutaneous. And from the posterior cord, we'll have two, the axillary nerve and the radial nerve, the thickest nerve in the brachial plexus. So this is the pattern of the brachial plexus, and I just used one color for all the portions or the parts of the brachial plexus because we're going to use different colors for the collateral branches. I don't want it to look messy. So the first branch of the collateral branches that we have is the dorsal scapular, dorsal scapular, and this one receives innervation from C5, and from the name it goes to the dorsal region of the scapula. It actually innervates levator scapulae and the rhomboid muscles. Levator scapulae and the rhomboid muscles. This is our first collateral branch. Another one will be the suprascapular nerve. The suprascapular nerve. And this one receives innervation from C5 to C6. The suprascapular nerve will innervate the supraspinatus muscle, and then it goes behind the scapula and innervates the infraspinatus muscle. So it goes below the spine of the scapula all the way behind and innervates the infraspinatus. So this one innervates supraspinatus and also infraspinatus. Another collateral branch, which this time goes below instead of going upwards, is the subclavian nerve, and also receives innervation from C5 to C6. And from the name, obviously, this one innervates the subclavian muscle, which is found below the clavicle. So, subclavian. These are the collateral branches from this region. From the posterior cord, we have three collateral branches that go like this. This one in the beginning is the upper subscapular nerve. This one at the end is the lower subscapular nerve, and both receive innervation from C5 to C6 too. And both of them will innervate the subscapularis muscle. The subscapularis muscle. And the one in the middle is called the thoracodorsal nerve. This is the thoracodorsal nerve. And it accompanies the subscapular artery. So the thoracodorsal nerve will receive innervation from C6 to C8, and this one innervates latissimus dorsi and teres major muscles. Latissimus dorsi and teres major muscles. So this is for the posterior cord. Now, from the lateral and the medial cords, we will have two collateral branches. One called the lateral pectoral nerve, and this receives innervation from C5 to C6. And we'll have another branch like this, which is called the medial pectoral nerve, and it receives innervation from C8 to T1. And the lateral pectoral nerve will innervate the pectoralis major muscle. Medial pectoral will innervate the pectoralis minor. Matter of fact, pectoralis major can also receive innervation from the medial pectoral. So, but mainly, this is for pectoralis major, this is for pectoralis minor, and both of them will give collateral branches like this, and they anastomose with each other, the collateral branches, to form something called the pectoral loop, and it gives branches for pectoralis minor muscle. This loop gives branches to pectoralis minor muscle. Finally, behind the ulnar nerve, we have two cutaneous nerves, like this, 1 and 2. The one in the beginning is called the medial brachial cutaneous, and the one right after it is called the medial antebrachial cutaneous branch. So from the name, it's very obvious that they are supplying the skin of the medial sides of the arm and the forearm. The arm is brachial, antebrachial is the forearm. For the one with the skin of the arm, the brachial cutaneous, it might have some connection with the intercostal nerves in order to innervate this area because they're close to each other. And For the antebrachial cutaneous, it might give an anterior branch and a posterior branch in order to cover the whole medial area of the forearm. And this is it for the collateral branches of the brachial plexus. And the next time we will talk about the muscles and the course of the terminal branches of the brachial plexus, their course throughout the upper limb, and what muscles do they innervate, and so on. So until the next time, I thank you for watching and see you.